Hi, I'm Dr. Rob Myers and this is Cardio Talks. I'm a cardiologist at Sunnybrook Hospital in Toronto, Canada. So how do you know when your doctor is terrible? Terrible might be a little bit extreme, but at least a physician that is not a good fit. In this video, I'm going to provide you a series of 10 items that I think are red flags. Mostly obvious, some a little bit subtle. Number one, time. We all need time with our physicians. You ever get a doctor that is holding onto the doorknob, spends about 60 seconds with you looking at the chart, waiting to leave? That is just a useless interaction. Who wants a doctor who spends 60 seconds, 2 minutes, 3 minutes, is just chomping at the bit to get out? A physician-patient relationship is very important in terms of the patient feeling satisfied, understood, has a good sense of what's going to happen moving forward. I mean, what's more important than our health? So having a doctor that spends a couple of minutes with you, I think that's pretty useless. Number two, a doctor who's late. Now, late is a relative concept. I mean, very late. I try to structure my clinic in a way that every 15 or 20 minutes I'm seeing a patient, and sometimes might be a more complicated issue and a person may need more time from me. So I might be a little bit late, but if I'm keeping you waiting 15, 20 minutes, a half an hour, I feel bad about that. I'm apologetic. Your time is as important as mine. But a physician that keeps you waiting for many, many hours in a clinic, sometimes there's these large volume clinics like dermatology or ophthalmology. Everybody just rushes in the morning and you wait and you wait and you wait. It is completely unacceptable to be sitting in an outpatient office waiting for hours and hours. Now the excuse is this built-in, oh, the physician is very busy. You know, when it's an outpatient office, we make ourselves as busy as we want to, often for a little extra cash. So basically saying that I'm, such a busy person, you have to wait for me. Now, where is there an exception? Well, one exception might be a surgeon. In a surgeon's office, they might be on call, they might have a lengthy surgery, trying to balance things. I get it when it comes to surgery. As with everything, there's always exceptions. Number three, doctors need to dress professionally. I don't want to be talking to somebody who looks like they are heading off to a snowboard competition or skateboard competition or going out, to the beach. You shouldn't be wearing shorts or a t-shirt or cut-off jeans. It doesn't really matter what the fashion is. A professional look is, I think, very important in making sure that a patient trusts me. Number four, a detailed history. It's amazing that I have to do a video that would include a detailed history as part of the necessary tools a physician is supposed to use. I shouldn't be just saying, oh, you have palpitations, and move on. Oh, you got chest pain? Order test, send you to a consultant. It's ridiculous. We should be going through details. Palpitations. How long have you had them? What do they feel like? How long do they last? How much do they bother you? Chest pain, where is it? Is it associated with other symptoms? How long does it last? What causes it? There's a million different questions. I'm not going to ask all a million, but a detailed history is very important. Number five, how about a physical examination? You ever go to a doctor who doesn't examine you? I have. Shocking. I've seen many patients as well who are referred late in the game. If their doctor had just done an exam, listened to their heart, listened to their lungs on a yearly basis, they would have captured that rhythm problem or a heart failure issue much earlier. So doing a basic physical examination is critical. Number six, big errors. You or your family members, did your doctor miss an abdominal ultrasound report? Do you have high cholesterol that's never been discussed? Maybe you have high blood pressure. Maybe you didn't get a colonoscopy when you should have. If a doctor makes a big error, that's a sign of a much larger issue below the surface. For me, it's a red flag. I would never see that doctor. Number seven, not answering your questions. What is more important than explaining to you what is going on in easy to understand language that's intelligible? Spending time, a plan of attack, what are we going to do? How are we going to investigate? Your questions are critical because if you leave my office and you don't understand your condition, I have failed you. I have completely failed you. It means basically that your anxiety levels are going to be higher leaving my office than coming in. It's important you understand what your condition is. You can't understand it without questions. And I have to answer it in basically an easy to understand format in a language that is clear. Number eight, a doctor that's minimally engaging. What does that mean? Well, I'm not going to use laser vision and bore through your eyes into the back of your skull so you think I'm interacting, but I shouldn't be staring at the wall, staring out the window, looking at my notes as I'm writing and not interacting with you whatsoever. A doctor needs to be engaging. When is there an exception? Once again, surgeons. If the best surgeon in the world isn't that engaging and is a little bit rude, I think I can understand that. Number 9, staying in your lane. I'm a cardiologist. If you start asking me about headaches, knee pain, and ocular symptoms, I better tell you I don't know. So many doctors are unable to simply say, I don't know. I think it's a terrible quality for doctors. It seems to be a bit of an egocentric idea that, well, I'm the physician, I need to answer everything. I take pride in staying in my lane, answering questions that I actually know the answers to without filling up space. I can't tell you how often a doctor will lead somebody astray. And staying in your lane applies to patients as well, right? Neighbors, friends, as I've talked about in previous videos, who give you medical advice, I don't think that's such a good idea. And the last, number 10, would be repetitive testing. Doctors who order too many tests again and again, the same tests every year, sometimes it's to make a little bit of coin, but generally you should understand the tests you're getting and what they actually mean. Now there's 10 items on my list. Every single doctor, including myself in our careers, are guilty of falling under some of them. I've been impatient, I've held on to the doorknob, I've sometimes talked in language people don't understand. I can vividly remember a patient I saw, an older fellow. He had serious heart disease called amyloid, and I remember being short with him, clipped, let's get to the point, answer my questions. And his daughter was so sweet. She said, could you just please be polite to my father? Boy, did I stop there. I thought, I'm a bad doctor in this moment, and what she said to me was completely true. And so I tried to step back and I tried to do a better job. And occasionally I will catch myself and say, okay, be mindful, be thoughtful. There's an anxious person in front of you. Do your best to try to meet the patient's needs. I hope that helps.